We're going to have a look at our plastic model of the spine and do some basic spinal anatomy to try and give you an idea of how the spine works and what it looks like. A good place to start is to ask you whether this is the front of the spine that you're looking at or the back of the spine. It's a question I've been asking recently, and I'm surprised at the number of people who just can't quite work it out. The easy way to understand it is that if you run your finger down your back, you feel bump, 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 bump on these spinous processes, these muscle attachments, and that's the back of the spine. Your spine's made up of a lot of bones. In between each of those bones, there's a number of joints. There's a big joint at the front where the disc is, and there's a couple of smaller joints at the back here, little pain-sensitive joints. In your neck, there's a couple of additional joints just tucked in here. It means you end up with 5 joints between every pair of bones. There's some very complex joints up and at the base of your skull where most of the rotation and lateral flexion's occurring. Lots of little muscles up there, nerves and blood vessels. It's a very complex part of the spine and something we pay particular attention to. In the middle part of your back, we've got ribs attaching onto these transverse processes, costovertebral joints, and we're particularly interested in these big joints here in your pelvis, sacroiliac joints. These are joints that people don't know much about. They'll tend to refer to this whole area as their hip or their low back, but really this ball and socket joint out here is your hip joint. This is your low back here. This big joint here is made up of the sacrum and the iliac bone. So you've got sacroiliac joint here and here. So it makes a very complex mechanical structure, and all of those joints need to move in a certain manner and a certain way for you to be able to function normally. But quite commonly what happens is areas become fixated or stuck, or sometimes we use the term subluxated. It really means the joints are just not moving quite like they should be. The joints in your spine, like the joints in the rest of your body, require good movement to keep them healthy. When they stop moving properly, they'll start to give you some trouble. Now, sometimes just a bit of localised pain and discomfort, and most commonly it will come out of those little pain-sensitive facet joints that I mentioned before. Over a longer period of time, if the joint's not moving properly, we'll usually see some degeneration in the joint, a bit of deterioration, a bit of arthritic type change. The other thing that we're particularly interested in from our chiropractic perspective is the very close relationship between the spine and the nervous system. And when the spine stops working properly, it will often irritate these nerves as they exit from the spine. Once these nerves are irritated, then we can start to see other things happening. Sometimes obvious things like a referred pain to your arm or a referred pain to your leg, but sometimes less obvious things like headaches, sinus problems, ear problems. These things can come back to what's happening with your spine. So when we start talking to you about looking after your back a bit better, getting your spine healthier, part of what we're trying to promote is your general health and well-being, as well as dealing with your particular aches and pains. When you come to our practice for an assessment, we'll spend a good half hour having a look at the way your spine's functioning. We're going to put you through a nice thorough orthopaedic and neurological examination where we really want to determine exactly what's happening in your particular case, and primarily we're interested in the biomechanics of the spine and how all these joints are moving.